Hi, my name is Brooke. Here at Toolkit Health and Diet, we would like to thank everyone for attending today's webinar that is being presented by Youth Advisory Council titled #Relationship Goals. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based health care. The School-Based Health Alliance's Youth Advisory Council, also known as YAC, was launched in 2013 as part of our ongoing efforts to support the youth voice in school-based health care. YAC is comprised of high school and college students and focuses on leadership, advocacy, and service aimed at the promotion of school-based health care at a national level. But before we begin, we do have a few housekeeping reminders. First, please help us with our attendance count. If you are viewing as a group only, please go to the chat window in the question box and type in the name of the person registered and the total number of additional people in the room with you. For example, Tammy Jones +3. This will help us with our final attendance count. Also, all attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the question box located in your GoToWebinar window. We will address all questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that will meet your needs. This webinar is being recorded and will be archived along with the slides on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archive webinars for topics such as announcing our 2016-17 new shorter census. Now I would like to introduce our presenters for today. Nate Batiste lives in Baton Rouge, Louisiana, and is a cheerleader and biomedical engineering major at Louisiana Tech University. He dreams of one day becoming a biomedical engineer focused on bionics to help not only his community but others. Nicole is from Omaha, Nebraska, and attends Southern Adventist University. After she graduates with a degree in international business management, Nicole hopes to pursue her master's in public health and continue to work with school-based health centers. Cameron from Roswell, New Mexico, attends Texas Christian University. She is the founder and president of Impact Teams. In addition to her work with School-Based Health Alliance at the national and local levels, Cameron is a Daniels Fund Scholar, a member of the John V. Roach Honors College at TCU, a member of Leaders for Life, a speaker at the National Honor Society Convention in New Mexico, and an alumni of Hugh O'Brien Youth. I would now turn it over to our presenters for today.
Well, hello. My name is Nicole Carrillo, and again, I'm from Omaha, Nebraska, so we're just going to go through some objectives. So we want to provide perspectives on the social determinants of health that influence relationships. We also want to offer skill-building tools for identifying unhealthy characteristics and creating healthy patterns. And we want to give ideas on youth-adult partnerships and healthy relationship programming. So we're going to start off by talking with family. So we all know that in a family, that's where you first learn about relationships. Daughter's first love is her father, and a son's, hero is, his mother. And so that's like where we learn so much about ourselves and about others. And so online, the School-Based Health Alliance has this amazing toolkit that is available to you guys as well. And it talks about, it's called the Youth Engagement Toolkit, and it goes through so many different resources, but one of them is parent engagement. And so on that page, just a couple quotes from there. It says, parents often serve as the primary source of information for their children on a variety of topics, including health. Now, we all know that to be true, and even further, it says it is essential that parents understand the importance of opportunities that empower their adolescent children. So when I talk about family, I'm not just talking about parents, even though they are the primary source of information. I'm talking about the community of people that come together to raise a child. And so, we all know the saying, it takes a whole village to raise a child. And as a school-based health center, or school-based health center providers, we all know that to be true. Where do children spend the majority of the day? They spend it at school. And where are school-based health centers located? They're located in school. So when I'm talking about family, I'm including the school-based health centers as a part of that child's family. So going on, so why is family important? So we all know that a family provides stability, they provide emotional support, they provide a place where the children learn skills and values, and even further, it's a place where the children learn appreciation and love. They learn how to relate to other people. They learn how to deal with authority, how to deal with peers as far as parents and siblings. And so if we go even further into Maslow's hierarchy of needs, the basic needs and the psychological needs are something that a family, as talking about the parents and siblings, that's something that the parents provide. A child cannot provide these things for themselves. And even going further into bringing the school-based health centers in, we can help determine if there's something wrong with a child just by looking at one of these things. So let's say that a child comes in with a headache. So we might, or someone might just think, oh, this kid needs some Tylenol just to get rid of the headache. But as a school-based health center, we go in and we ask questions. We ask, did you eat yesterday? What did you eat yesterday? Are you stressed out at home? Why are you stressed out? And you go through these needs, the food, the water, rest. Are they getting rest? Or are they taking care of their siblings? So we can help determine if there's something wrong at home just by looking at these different needs. So we might not be able to provide that food, that rest, the warmth. However, we are an essential part of this child's family, because we can help determine if they need help getting these different resources. So this leads directly into the social determinants of health. And so the structural determinants and conditions in which people are born, grow, live, work, age. And if you look at this chart, 40% is based off of socioeconomic factors. Now, school-based health centers are doing an excellent job, on the first one, education. We are in that place of education. We're located in school. So what better way to reach students than being where they go to school? But then you also look at family and social support. So a huge factor of a child's health is their family. Again, are they getting, do they have the opportunity to get enough food at home? Do they have the opportunity to get enough rest? Or do they have to take care of their siblings? Are they getting, are they getting health care provided to them? Do they have insurance? Just these different things that go along with their socioeconomic factors, and even further in their family, determines their health, not only for their adolescents, however, but for the future as well. And so going on to the next slide, there's other stuff directly tied into family that affect their health as well, or their access to health. So again, as I mentioned earlier, insurance or out of pocket. Does the family have the ability to pay for insurance, or is that so expensive that when they have to go to the doctor, they can't because it's too expensive for them? Distance to health clinic. I know a lot of families don't have cars, and they rely on the bus system or walking in order to get to a health clinic. And in some cases, that's not doable. In some cases, a health clinic is too far, and then the parent sees it as, you know, more tiresome and a lot not necessary for the kid to go because it's going to take too much time. Also, number of family members. I have known a lot of families that have 5 or 6 kids, and taking them to the doctor every single year for their physical is too expensive for them. And so they have to determine which kid needs to go to the doctor more, which kid is, you know, severely ill, which kid needs prescription medication. And so they alternate with their kids, and their kids are not going to the doctor. They're going every 5 or 6 years because their parents cannot afford for all of them to go to the doctor every year. And also the primary caretaker's employment. Now, as school-based health centers, one of our biggest pushes for school-based health centers is that it minimizes the amount of time that a child is out of their seat. And this is great for the student, but it's also great for the parents. Now, I grew up in Omaha, Nebraska, and we have a lot of refugee families and a lot of meat packing plants. And a lot of those parents could not leave their job. Leaving their job for even 2 or 3 hours a day just to take their child to a health clinic meant that they were losing almost a day's wages. And that didn't just mean that they were losing a day's wages, but that then in turn, you know, affects their grocery budget, affects their rent budget, and it makes everything just a little more difficult. And so the fact that a school-based health center is placed where it is so amazing, honestly, because we can provide health care for the student, and the parent does not have to leave their place of employment. And so I also have prevention instead of intervention. A lot of these cases, if a family cannot afford to just go and get health care, you know, a family might wait for a child to have an asthma attack to take them to the emergency room rather than just maintaining their asthma, going and getting regular checkups to make sure that the lungs are okay, that the child has a current inhaler. So instead of maintaining a child's health, we're just treating every time that a child is severely sick. And that's not what school-based health centers we want. We want a child to be healthy all along. And so one might wonder, so going into even further with the toolkit, how do we get parents involved? We know that parents are very vital in a child's development. However, a lot of the times parents are just extremely busy and they can't take their kids to the doctor. So how do we get them involved? So these are just a couple or a few of the things on the toolkit online. So the School-Based Health Alliance Youth Engagement Toolkit. And then the last one is just a community project that we just found very, very interesting. And so a couple of things. So meet the parents where they are. And a lot of the times, parents are at school. So in the afternoon, parent-teacher conferences, at registration days, these are things that parents have already allotted time for because they're necessary for their child that's going to school. They need to register their kids for classes. They're already going. Have a table at parent-teacher conferences or have a table at registration, just giving information to parents, getting them involved already. And then going into the next, or number 3, I'm so sorry, this is a time when you can pass out a calendar with the different events for the year or the different important dates for the year. You know, maybe the sports physicals that you're offering, or when you're going to have a flu vaccine clinic, or when you're going to just various different things that parents will want to be informed about. And then number two, one of the things that my high school did is have the consent forms and have all of the information inside of the registration packet, of the registration for school, I mean. They're already going through this packet, and it's not just a random paper that's going to get lost in a student's backpack during the year. And that way, you already have the consent form at the beginning of the school year. And a very interesting thing that my high school did is we had this in our registration. The majority of our students turned it in at the beginning of the year. But then towards the middle or towards homecoming, they just wanted to get a little bit more into a little bit of the students that were just lost during registration. And so they did a huge raffle. And so if you hadn't filled it in and you brought it in the week of homecoming and you were put into a raffle and you got a limo, that would take you to homecoming. And so it's just little things like that, and that incentivizes students to bring those consent forms, and even the parents, you know, they're going to learn about it. And then going into parent cafes, if you want to just go forward a slide. So this is actually something introduced by Alameda County. And so their entire goal was family strengthening and parent engagement. And so this is a very cool thing that they did, is they had these classes. So these were 6 weeks, and they met for, I think, for 2 hours at a time, once a week. And they just had skills building. And so this is parents that were learning how to listen to their kids without being judgmental. And they just got to this entire group or this community of people that could support each other. Parenting is hard, and being a part of a family is very difficult. And the school-based health centers were there to help promote a healthy family atmosphere. And so this was just really great. Everybody that was a part of this was very, very excited and was very happy with everything that they had learned. And so getting parents involved is something that's very great, and it's something that is extremely beneficial, not only for the school-based health centers, but also for a child's development. But sometimes you can't get a parent involved, and so we have to go into a different way to seeing if there's anything wrong with the family at home. So if you want to go into the next slide, that'd be great. So one thing that we can do is surveys. And you don't necessarily have to ask, is there anything wrong at home? Because most of the time, a child is going to want to say no. They're not going to want to say, you know, all these negative things. But there's different questions that you can ask to see if there's a problem at home. And so on the next slide, here's a questionnaire done by Bright Futures, and it just asks a variety of questions. And this is a very lengthy questionnaire. It was, I want to say, 8 pages, but it had this entire, I just want to go into the next thing. It just asks a variety of different questions. I'm going to just click one more, I'm so sorry. So, have you seen the dentist in the past year? Do you eat more than one fast food meal per week? Do you participate in physical activities? Do you eat 5 or more helpings of fruit and vegetables a day? Now, this questionnaire isn't asking, you know, how's your relationship with your family at home, or how is your family situation, but it's asking a variety of questions that can lead to us asking more questions. So if we see that, you know, they don't get all of the nutrients that they need, we can ask, well, what have you eaten? Why is that? And then we have a question to ask. We have evidence that they have told us. And so this is just, again, one of the ways that we can measure or just see how a child is doing in relationship with their family at home. Because we all know that a family is the basis, the home is the basis for the future. And this affects just every aspect of their life, of school, and especially friendships as well. And so I'm going to hand it off to Cameron, who's going to talk a lot about friendship. So thank you so much. Thank you so much.
Thank you.
Thank you so much, Nicole.
Thank you. And we also have 2 poll questions for our attendees. And our first poll question is, My Help Center provides programs and services for parents and families. Can you please take a few seconds to answer the question? Great, thank you everyone. And these are our results, and 45% of you said yes, and we have one more poll question for you. Our next poll question is, My Health Center provides group-based activities in education for adolescents. Please take a few seconds to answer the question. Great, thank you everyone. 50% said yes. I will now turn it over to our next presenter, Cameron.
Hello guys, thank you for listening in today. And just to get right into it, I'm going to talk about the social determinants of friendships and like how those relate to a person's health. And as you can see on the screen, social integration and a support system can be facilitated by friendships, and this is essential to the part of the social determinants that is the community and social context. So these things are important to a person's social and mental health. And if you can go to the next slide, please. There we go. Oh, okay. So I'm going to talk more about how friendships are developing today in a modern sense. With a rise in technology and social media, we're seeing that friendships are developing differently nowadays than what they used to. So to the next one, please. Thank you so much. So what we're finding is that deep friendships are much more difficult to maintain online. For, in general, not talking about every woman ever, but for females, they're more likely to tend to create your relationships face-to-face. It's giving little parts of yourself and sharing things that can help define that deep and intimate friendship. Whereas males, and again, this is not for every male, but just in general, they tend to create relationships side by side. So this is them going out and actually doing things together, whether it's playing video games together, playing basketball together, going to see a movie together. That side-by-side actions can create that relationship. So as you can see, both of these two methods of creating a friendship aren't compatible with online. It's difficult to show that emotional weakness, that insecurity, and then all the qualities that can define and develop a intimate relationship that youth need during this time in their life. Next slide, please. All right, and so another problem, and this is for across the board everyone, is that we are so busy that it's so easy to just cancel our plans. And instead of you used to have to call your friends and say, hey, I can't make it, and then you'd have that the negative response of hearing from them, oh, I'm sorry, and like having to apologize and all that. But nowadays, you can just send a quick text being like, hey, I can't make it, and then you're rewarded by getting to stay home and sit in your sweatpants and binge watch Netflix. So before hanging out with your friends in person had a positive reaction, canceling your plans and hanging out at home has now the positive reaction. So we're seeing not only are people communicating over media, which is more difficult to create those relationships, but we're also slowing down our amount that we actually hang out in person. Next slide, please. So what can school-based health centers do about this? How can they facilitate peer interactions? And peer groups is one of the best things that a school-based school-based health centers do. As you can see on the quote here, more than half of SDHCs have effectively harnessed the power of peer influence in adolescence by providing group-based activities and education. So as you can see from our poll, it was pretty accurate on where we're at. With my impact teams, this is what we did. It was a group of females who got together and we just talked about what was happening in our daily lives, and then we had a service provider there to help give advice and give us health education. And then afterwards, after learning from them, we went out and we acted upon what we learned and taught others. So for me, this helped me meet people I would have never interacted with before. It definitely helped me develop relationships with other people because you are sharing very, very personal and deep information with people that you trust. And then having it in the school-based health center makes it so that we are informed and educated about different aspects of our problems in the correct way. So the next slide, please. Thank you. So cyberbullying, as most of us know, is very commonplace online, and it is something that is definitely new to a school environment. And for one, school-based health centers, of course, aren't going to be directly involved with cyberbullying, but they can be involved in the youth emotional health. And being aware that this could be a cause for that can make you better able to provide care. So an example of this is, and I have the link down below if you want to click on that later, is in New Mexico there is a group called Natural Helpers. And what they do is they provide training to youth on a variety of subjects, and then they go out and share their information with their peers. And it was originally developed to prevent suicide. So with a program like that, it is having youth being on the forefront with the education that the SDHC had provided, going out and helping with things that could help things such as cyberbullying and making it a more friendly school environment. And that's something that the SDHC can definitely be a part of, is making sure the school environment is safe and friendly and helping changing that school climate. So all in all, moderation is key. We're not going to get rid of social media. It's always going to be there, and it's probably going to only increase. But it's important to keep that balance, and it is important to also use the benefits of social media. Here on the Youth Advisory Council, we use social media to get out information. We have a Twitter. We're sending out tweets daily about when convention is and when our webinar was, and just different information like that. And using social media to your benefit to reach out to your youth in your schools and to reach out to your community about different events you're having can be greatly to your benefit. It's not all bad, it's just using it in a way that can be positive. Thank you. Next slide, please. All right. And then so you have these 4 components of a healthy friendship, because this is just, these are actually honestly important for almost any relationship. So the number one is to be supportive, and that's to be there for your friends, to care for them, to be there when you need them. And the second is to communicate. And this is really where the social media comes in, is whenever you're communicating with people, you lose that body language, you use the facial expression, you lose the tone of voice, all things that are very important when you're communicating to someone. So this is a part where social interactions become so important, is for that communication side of that relationship. And the next one's investing time, and this is important for any relationship. It's important for even your relationship with your parents, with your significant other, with your even with your school and schoolwork. If you invest time in it, that relationship will grow and will develop into something great and healthy. And the last one is very important. The last one is give and take, and this is this is where you can figure out if your friendship is unhealthy. If you are constantly giving and giving to this friendship while you're receiving nothing and you're not taking anything from it, then that's how you know you're in an unhealthy friendship. So these 4 components are important to understand when you're providing care to help youth who are struggling with unhealthy friendships or are in a situation where they're trying to develop that peer-to-peer interaction. And unhealthy friendships is very similar to unhealthy relationships, which Nate will go into next. And Nate, take it away.
Yes, and before Nate starts, we have one more poll question for our attendees. My Help Center provides counseling on dating violence and healthy relationships. If you can please take a few seconds to answer the question. Thank you. Okay, great. Thank you, everyone. And it shows 67% said yes. I will now turn it over to our next presenter, Nate.
How is everybody? I am Nathaniel Baptiste, and I will be presenting today on the unhealthy relationships versus healthy relationships. And so, in our first slide here, if you can go to the next slide for me. Among high school students who have dated, 21% of females and 10% of males have experienced physical and or sexual dating violence, which means that their partner has abused them either physically or sexually. And so if we continue to our next part of this slide, many men and women have gone through domestic abuse, and it's less reported with men than women because men tend to feel this humiliation when it comes to the topic, and women tend to feel scared. So some men and women don't report it because of these two. And so with men, they feel humiliated because they feel as though they should not let it happen because they feel as though it's a woman that's hitting them. But many men have been growing up on you shouldn't hit a woman. So by them not hitting back, they feel kind of humiliated and also a little scared. Like women tend to feel scared because it's usually a much bigger male that usually physically abuses a woman. And so with our next slide, we'll be talking about stalking in relationships. So about half of all victims stalked indicated that they were stalked before the age of 25. And 14% of female victims and 16% of male victims experienced stalking between the ages of 11 and 17. So that's between the prime ages of when you first start dating with someone. And usually stalking first develops with over excitement for a person. And so youth who are victims are more likely to experience symptoms of depression and anxiety, engage in unhealthy behaviors using tobacco, drugs, alcohol, or exhibit antisocial behaviors and think about suicide because most of the time they receive threats because their stalker doesn't want them to be with anybody because if it's like someone in love with the person, then they feel as though that person should only be with them and only them, which leaves the victim to become scared and don't know who to run to sometimes. So we just have to be aware of these things. And so if you can go to the next slide for me. There was this report or survey within the California school-based health centers, and what they did was a group of 1,062 teens between the ages of 14 to 19 were surveyed for exposure to relationship abuse, including cyber dating, sexual behavior, care seeking for sexual and reproductive health at 8 of the school-based health centers in California during the 2012-2013 school year. And within these 8 school-based health centers, 4 of them received training on how to properly talk about it, and 4 did not. And so out of 400 students reporting abuse at the initial visit, 65% of those were still reporting such abuse 3 months later at school-based health centers versus the 80% in schools without intervention clinics. So it was a little more of them not reporting abuse at the ones without intervention clinics. And the survey happened only once a couple of years ago, but as you can see, I have a quote here from Dr. Elizabeth Miller. She said, creating spaces for young people to learn about healthy and unhealthy relationships and how to help their friends can really help reduce adolescent relationship abuse. And she plans to put on this survey again to see how much different and to see what they could do better and what made the percentages, like what caused them not to report it again, or what caused those in the intervention without the intervention centers to report it a little bit more. So they just want to see what happens and why these things happen. And so if you can go, okay, and so in this next slide, I go to Louisiana Tech University, and we have a counseling center, and I talked to one of the counselors whose name is Dr. Robert E. Burt. He is he is a licensed professional counselor. He's also a national certified school counselor with a specialist degree in counseling psychology. And so I was talking to him about domestic abuse, domestic violence. And so I asked him what were the steps into it. And so the first 3 steps are always the same, whether it's the counseling route or reporting. And so the first one is get their statement, either handwritten or electronic. And so they can either write it down or type it on the computer to have a backup. And so he talks with the students to calm them down, and he gives them the choices of counseling or to report it. And when he talks to them, he sits down and he has so much experience with it that when they go in there, they 9 times out of 10 come out feeling much better than when they went in. And so with the counseling route, he talks to them with multiple sessions, and he makes time for them. He says that all students are number one because the students are number one. I mean, he puts them number one because students are number one. And he emphasizes that to the T. He is always putting students first. And so with the reporting it, he notifies the police and makes an appointment with the police chief. And they filed what is called an assault report, which means that they name their assailant, they name what happened, when it happened. They try and give as many details as possible. And so with this, they can report it and not file charges if they're scared to, but they can also press charges, which could lead to a restraining order. Or if it was severe, they could do what is called a level 3 charge, which is arresting the assailant because that person has suffered much battery, the person is scared and has psychological distress now. And so me and Mr. Burt were talking, and I asked him, what in your opinion would be the first steps after someone has become a victim of domestic abuse? And so this is what I was talking about when I said he talks with them. If it's physical abuse, he says go to see a doctor. If it's psychological and emotional, talk to a counselor, a priest, a pastor, a family member, anybody that you feel safe with. Sexual abuse, don't destroy the evidence. He said go straight to a medical facility and get a rape kit performed. But overall, the first thing is always to report the incident, because if it doesn't get reported, then it's most likely going to keep happening. It's going to become repetitive because the person is going to think that you're not going to do anything, that you're too scared, or that he has control over you now. And so with that, like, I know that was kind of dark, but I want to go talk into healthy relationships now. And so with this first slide, it's this paper from The Cost of Living by Baker, Stewart, and Levine back in 2002. And within the first slide, if you can flip to the first slide for me, these are 7 identities that you should be looking for. And so I kind of want to pick on number 3. As you guys can read it, I want to pick on number 3. And it says, be willing to initiate renewed trust. Oral commitments are essential, and make it a ceremonial vow, which means make sure if you say something, you keep your word on it. So if you say you're going to be somewhere or you're going to be there for someone, make sure you're there, because that on the road to recovery, that can really be essential. That can be that step that either leads them forward or back, because if they can't trust a close friend, then they're going to feel as though they can't trust anyone. So just be open-minded to that. And so to the next slide, if you will, please. It's called Connecting with Students. And so if you can go one step, these are sample questions from the sexuality portion of the HEAD survey. And so it's to be able to talk with students to help you speak with patients on their relationships. And right here on this slide, is questions from the sexuality portion so that you can help them speak with patients on their relationship and lives. The HEAD survey is a practical, time-tested strategy that pediatricians can use to evaluate how their teenage patients are coping with the pressures of daily living, especially in the context of electronic and social media. Because it, like they said earlier, it can be really overwhelming. And so the HEADS interviews focuses on assessments of home environment, education and employment, eating and peer-related activities, as well as drug and sexuality, suicide and depression, and safety from injury and violence. And so if we can go to the next slide, please. This is one of my favorites. When I was talking to Mr. Burt, he gave me a paper, and so it was called The 5 Languages of Lasting Friendship and Love. And so we're talking, and this is what he said is 5 key things to build a friendship and a lasting love. Because if you don't have a friendship, then a friendship is kind of the foundation of a relationship. So if you don't have a friendship, then you really don't have a stable foundation, which means that either friendship or love could fail. And so it's just the quality of time, word of affirmation, which means that you're not always saying something, but you're saying something to reassure them of themselves. And quality time means spending time with them. Gifts, it doesn't have to be like fancy, like $300 watches. It could just be little tokens that mean that you care for them, like flowers sent to them on a average day, roses, candy, just something simple. Then acts of service, like if they need something, you're there to help them out. If they're if they're desperate for some help, just be there to step in. And then physical touch. Now, most people take this a step further meaning something sexual, but it's not really sexual. It's just meaning like hand holding, a simple kiss, a hug. A hug assures somebody that you're there for them and that you're caring and loving and that they can just rest on you, which means that you'll be there for them. And that's why this one was really kind of important to me. And so I just want to thank you guys for listening.
Thank you so much, Nate. Now we would like to give everyone the opportunity, if you have any questions, to please enter your questions into the question box. And right now, while we just give you a few minutes to enter your questions, we do have a few announcements of our own. We want to start off with our membership. School-Based Health Alliance works to improve health status in children and youth by advancing and advocating for school-based health care. Our members extend and support our work. Trainings like this webinar would not be possible without the support of the members. And you can also go online for our website for more information about our membership. But also with our membership, you can receive a discount to attend our 2017 National School-Based Healthcare Convention as we partner with California School-Based Health Alliance. The convention will take place in Long Beach this year in California on June 18th through the 21st. And also we will have, we will include the Be the Change Youth Training Program. So please visit our website for more information and to register. Please again join us in California this year, June 18th through the 21st. Okay, we do see a question coming in, so you can just give us 1 second. Thank you, everybody. All right, so maybe, and Ada, you can ask it. So a person wants to know how can they work on relationship issues in school, the student with their parents. What advice would you give?
Hi, it's Cameron, and I'll give my opinion on this. I think one of the best ways to help with peer relationships is to definitely is to start your own advisory council. Personally, I made a lot of friends that way, and that really helped me develop how to relate to my peers and how to talk about topics and subjects. And at the same time that you're doing that, you're also providing education. You're also training these kids to educate others of their peers. So I think that's an all-around.
So a question would be, how how would you go about starting a youth advisory council in the school? What advice would you give?
Hi, it's Nathaniel. I started my own youth advisory council, and so the way I took is to first get into it, you have to first get in. You can either go to another SBHC within your area, whether it's at another school or if it's one for your whole town or city, or you can go to the main office. And so what you do is you get in touch with them and say you want to start an advisory council based off of it. And so if they don't have one already, then they will most likely invite you in and start working on the schematics of it. But once you get that with the SBHC, then you want to go back to your school and you want to shoot the idea with your principal, because your principal is going to be the key to you doing events in your community, outreach to the students in your school. So your principal is really key in that.
Thank you so much, Nate. Our next question is, do you have any suggestions on how to start talking to youth and helping them understand how technology is affecting relationships to get them on board with trying out some of the in-person communications and other healthy communication styles?
I think probably one of the best ways to help youth understand how technology affects their friendships.
Yes. Can you repeat that again for me? Go ahead, Nate.
Okay, if Cameron isn't going, but we wanted to do the same thing at my high school, and so what we did was we challenged students. We told them and we asked them, go the school day, start off with the school day, and try not to use your phone. Try to talk to as many people as you can around you. And so out the students who did it, we found that they connected better to their peers. They found out more information about their friends, and they were more in tune with their classes. Now, a lot of them did not complete it. They couldn't go the whole day with it, but some of them tried, which is the best thing, is to try. Try, because if you can see the difference between you with a phone than with you without it for maybe even just 30 minutes. And if you go there 30 minutes and you talk to people not on your phone but face to face, you can totally tell the difference between a conversation.
And I think I'm sorry, this is Nicole. I think something that's really important, and I mean, this isn't necessarily how you can start the conversation, but I think something really important is to not, just tell them that they can't do it anymore, because it's just going to make them want to do it even more. I think it has to be one of those things where the kids are going to have to learn, or adolescents or teenagers. It's going to have to be something that they choose to do. Like Nate said, some of them couldn't make the day, but they had the choice to go back to it. It wasn't something like they had to go the entire day without it. And so that even makes it more meaningful, as they got to see their own weaknesses and, what they could and what they can't do and what they need to work on.
All right, and what are ways that you guys can, or others can, share their work within the community?
This is Nate again. So a great way to share your work in the community is, I think the simplest thing would be to get your community involved. Like if you have a project, or like if you have, let's say you're doing breast cancer awareness, go out through your community, pass out flyers, talk to your community members, just get them involved, because the community is where you're going with the project. So if you can get some of the members to even talk to other friends and family about the project or the event, then that gets more of the community involved than just you by yourself, or you and your council in your school talking to the students of the school. Because 9 times out of 10, students aren't going to go relay that information back into their community, back to their parents. So it's up to you to, in my opinion, to go out into your community and spread the word.
Personally, this is Cameron. One of the great things that my school-based health center did is they organized a health fair. And what they did is they invited other local organizations who have an interest in youth. So they invited, we have a program called the MASE, and it's about engaging Latino youth. And then they invited other community members, and they basically other organizations who deal with youth, who deal with health, or anything along those lines. Invite them to this health fair, and they held it at the school. And then usually it's always been a huge hit, and it's always been a way to share ideas, to network with people, to see how other people are connecting to youth, how other people are getting information across, how are they advertising their what am I thinking of, their goal, their passion, what they're focused on working on. And for us, our health fair has always been had a great attendance, and also that goes back into parent engagement, because parents usually come, and usually the teachers offer like extra credit if they attend, and it's usually held later at night, so people are off of work. And for us, that's always been a good way for us to connect to our community and learn and share with them.
Great. Is there anything else that you guys want to add before we conclude our webinar? Okay. Great. We thank you so much, Nathaniel, Nicole, and Cameron. We do have a few questions for our attendees. We will just like your feedback. If you can please take a few seconds to answer the question. And our first question is, did this presentation meet your needs? If you can please take a few seconds to answer yes or no. Thank you. Okay, great. Thank you. Our next question is, how well did the presentation meet the stated objective? Okay, and how likely are you to apply the information from this presentation in your organization? Okay, and our final question is, would you recommend this webinar to others? Okay, thank you, everyone. Again, if you have any questions, please visit us at info@SBH4All, and we hope that everyone has an amazing day. Thank you.